Latasha. I'm a student nurse, and I have verified doctor's orders to place a Foley and a patient. I have my supplies. I verified my doctor's orders, and I'm going into my patient's room. Before I go into the room, I'm going to knock on the door. Knock, knock.
Come in.
I'll close the curtain behind me to provide for privacy. I'll wash my hands. Good morning, Mrs. Jones. My name is Tasha. I'm a student nurse. Can you verify your name and your date of birth?
Mrs. Jones, 7588.
Okay. Her name and date of birth matches with my order. Mrs. Jones, your doctor has ordered for you to have a Foley placed. Have you ever had one before?
Yes.
Okay, great. I'm going to ask you a question. Are you allergic to any iodine, or do you have any allergies to shellfish or any medications?
No.
Okay. I'm going to go ahead and get started. I'll wash my hands again. I'll make sure that the table is clean. I have tape, and I bought an extra pair of sterile gloves just in case if I need them. I'm going to go ahead and place the bed up to working level. I'm going to put your head down, okay? For the purposes of the video, I would normally do a 4-corner spread over the legs, but for the purposes of the video, I will not be doing that today. Rather low. I'm going to go ahead and raise your legs up. I'm going to go ahead and start getting it all set up. Just put the tape back. So I'm going to go ahead and open up my kit. I'll wash my hands again, open up my kit. I'm going to use this as a little bedside trash can. Go ahead and pull the gown down just to provide for a little privacy while I'm getting everything ready. I can open up my kit. I have a 1-inch border, so I'm making sure that I keep my 1-inch border. Take this. Make sure I get the absorbent side. Shiny side down. Over here. Get my sterile gloves. Do my dominant hand first. hitchhiking my thumb so that I don't contaminate them. Now, once I have on both gloves, I can go ahead and correct my fingers. Go ahead and take the vintage shredded drape. Just go ahead and lightly just drape it over. Now I'm just going to go ahead at this point and go ahead and check my kit. I am sterile. So I'm just going to go ahead and open up my iodine, put it over my cotton balls, open up my lube here. I'm going to go ahead and take my syringe and insert and attach it to the hub to make sure that it works properly. And I'm going to be sure to inflate the entire balloon. All 10 cc's are in. There's no leakage. I'm just going to go ahead and let it passively deflate. While this is sterile, I'm just going to go ahead and take off the cover off the tubing and just lay it back into the sterile container. Place this back on, and now I'm ready to go to the bedside. Now I'm going to go ahead and put one hand over her pubic census and in a C shape open up her labor majora and her labor minora. Going to go ahead and clean the farthest labor majora, labor minora. One wipe, come back over, throw it away. Clean the other side and down the middle. I'm just going to go ahead and lube the tip of the catheter. Okay, Mrs. Jones, I'm getting ready to go in on the count of 3. 1, 2, 3. Now just go ahead and insert the Foley. Once I see urine, so now I can go in another 2 to 3 inches. Okay, I'm going to place my hand here to hold it in place. Go ahead and inflate the balloon. Make sure that the entire balloon is inflated. Before I take my hand off, I'm going to give it a little tug to make sure that it's in place. It is in place. Go ahead and disconnect. And take this now, and I'll just go ahead and clean out any extra iodine and things of that nature. With my tape, I'll go ahead and tape this to her leg to ensure that it's not moving. At this point, I'll go ahead and take off my gloves so I can work a little bit better. I'm going to attach this to a non-movable part of the bed. Take all of my supplies. How are you doing?
Good.
Okay, great. You did good. Cover her back up. Put her call light back in reach. Would you like to stay down or would you like to be back up?
You can leave me down.
Okay. Go ahead and let your bed down to the lowest position. Her call light is in reach. I'll go ahead and wash my hands. I'll open up the curtains. Is there anything else I can get for you, Miss Jones, before I leave?
No.
Okay. Once I'm finished, I'll make sure I document and we're done. Thank you.